So what I wanted to talk to you this afternoon about was really the ecosystem and really how data is changing orthopedics. So we call this ZB Edge, but data, obviously, there are some very sinister elements of that. And I thought it was relevant to really start by saying that really from a Zimmer Biomet perspective, the patient is always the patient and never the product. Patient data is used to create value for patients and their care teams through our algorithm systems and products to support our commitment to the highest standards of patient safety, quality, and integrity. The privacy piece, privacy really is a fundamental human right, and Zimmer Biomet maintains robust practices to help ensure the rights of patients are protected. Patients and customers decide what they share with us. From a security perspective, Zimmer Biomet protects the data that patients and customers entrust us with through strong safeguards. Among other measures, we apply encryption in transit and at rest. We have scheduled security risk assessments and penetration testing by third parties. From a usage perspective, Zimmer Biomet will only use customer and patient data to provide the services we have agreed upon and for purposes that are compatible with providing those services. And an ownership which is very, very important. And we put the patients and customers in control of their data and have established tools and processes that give patients easy options to exercise their rights with respect to personal data about them. So I think, with this transformation and this mass grab for data, and we see it in all elements of industry and in our day-to-day lives. I just really wanted to create that perspective to give you a sense of security and also your patients as well. And as I've just said, we are driven by our mission, which is our commitment to the highest standards of patient safety and quality in our products and services. We're committed to world-class integrity and ethical-based business practices. So what does that mean to you today? So when we look at today's needs, we really look to improve surgical techniques, advancements in material technology and new implant designs. Artificial joints, which can be expected to survive decades, as a number of discussion points have been made over the last hour or so. But challenges with orthopedic care remain. Consider the patient who presents with pain several years after a knee replacement. Their x-rays look good, but this is of little consolation as they experience discomfort and pain on a daily basis. We need a solution to help make smarter decisions with objective data. Or consider healthcare professionals at every level and all around the world who are required to do more with fewer resources. We need tools which help provide care more efficiently. And as patient and caregivers rely increasingly more on technology to find and provide care, it's imperative those systems are integrated and easy to use to provide the best experience. Along the patient journey, care teams are called upon to make critical decisions that determine health outcomes. Augmenting data-driven intelligence to the care continuum powers progress in outcome and provides previously unseen clinical insights which support the best care options to be taken. Zimmer Biomet with ZB Edge technologies generate objective data at every interval of the episode of care. Preoperatively, that begins with My Mobility Care Management Platform, our app that collects preoperative mobility metrics, as well as data on compliance with education, surveys, and exercises. ZB Edge integrates advanced planning technologies, allowing clinicians to get accurate information on the patient's condition to help inform treatment decisions. And through the My Mobility application, care team members are automatically alerted to relevant changes in the patient's preoperative condition through signals from the gait. In the operating room, ZB Edge brings together multiple technologies, including ROSA, OmniSuite, OptiView, which Dr. Vaidya talked to just a second ago, that objectify the surgical experience. And OptiView really is probably that voice-activated mixed reality tool that, again, is going to be a part of the ROSA platform, which we'll see next year, which will be voice-activated. So, again, it's creating that efficiency that we should certainly seek. Post-operatively, ZBEdge connects patients to their care teams like never before. My Mobility automatically pushes educational content to the patient's phone, and telemedicine visits and physical therapy can be easily initiated in the app. Finally, ZBEdge expands the possibilities to collect and connect data for an extended period of time with a first and only smart implant, Persona IQ. With it, care teams can remotely monitor patient activity, and patients can feel connected to the care team every step of the way. Feedback loop of information gathered before, during, and after one surgery to inform the next is really the way that we're going to capture data and learn more about the patients that we serve. Comprised of technologies that deliver three primary values, we're smarter with our decision making with a goal to improve outcomes, faster and more efficient care, and with better value and experiences both for the healthcare providers and for the patients. For ROSA Robotics, again, as the faculty have talked about, we need something that is efficient and integrated, so something that provides multiple applications. ROSA is really a multi-application. It's been designed to be a multi-application platform that works with you, not for you. Utilizing Zimmer Biomet's leading implants and data technologies, ROSA Robotics redefines robotics by providing real-time insights to optimize outcomes with the aim of revolutionizing the standard of care. As your market access allows and your regulatory environment allows, we have three current applications: knee, partial knee, and hip, and we will be introducing shoulder and revision knee with iterations of the knee platform in the coming months. So when we look at ROSA, we can look at really elements of it, which really we have four pillars. The first is surgeon-centered. So the surgeon can maintain current approach philosophy and technique, including personalized alignment, if that's something that they choose. Technologies are only as good as the implants they are used with, and ROSA provides you with flexibility to utilize our leading knee brands of Persona with the personalized knee. The Persona knee is Zimmer Biomet's most comprehensive primary knee system, incorporating personalized implants, precise instrumentation, and proven technology. Since its introduction in 2012, surgeons around the world have implanted over 1 million Persona total knees.
Mr. Keith, sorry to disturb you. We are running short on time. Could you please give your concluding remarks? We are really short on time over here.
Yes, absolutely. Yeah. Sorry. Thank you. So I just wanted to share with you an example of the technology that is working today. So if I could just leave you with this short video, it's really a great assessment of what the integrated health system can do for you today.
Specialist knee surgeon. I have a patient who lives in a rural area about 2 hours from my practice. This fellow is a farmer who works hard for a living. I performed a successful bilateral knee replacement on this patient. When I saw this patient for his post-op check around 2 weeks, everything looked good and I thought he was looking at a favourable outcome. To keep track of his recovery after that checkup, I used Walk AI. After the surgery, I received a remote alert. The patient's step count was down substantially from 3,000 steps a day to around 800. The patient was showing poor gait speed and gait asymmetry based on expectations from Walk AI's wider population data. Obviously I was concerned, so I called him to ask what had happened. I said, "Listen buddy, you're walking badly, what's going on?" And he said, "I'm not walking badly." I said, "Yes you are, I know you are, so what's happened?" I said, "I want you to confess." And he goes, "I know I promised to stay off the tractor for 5 weeks, but I had to get on it, and I put the front wheel into a ditch and it threw me out of the tractor." The outcome was that I was able to intervene immediately after the event and long before his next physical appointment, at which case the window of opportunity would be lost.
Walk AI from Zimmer Biomet. To learn more, go to zimmerbiomet.com.
So I just wanted to take this opportunity to thank both Dr. Vaidya and the faculty of ISRJR for inviting us. And I certainly would concur with his thoughts that really Indian surgeons are at the forefront of technology innovation, and their ability, with the severity of arthritis and end-stage osteoarthritis they see, the influence that technology can play. And I hope you can see that the integrated system that Zimmer Biomet are offering are really providing real-time insights with the ability to intervene at an optimum point today, and that's not a futuristic thought. So we certainly look forward to working with you in the future to develop these systems and innovations as we embrace technology further. Thank you very much.